My name is Sean FitzGerald. I'm our Senior Development Coordinator. I oversee a lot of our um, community engagement efforts with the chapter, most recently with our Type 1 Nation Summit that occurred at Roche. And I'm excited to kick us off with our very first Virtual Connections Program meeting. This will be an ongoing educational series, opportunity to connect and engage with one another during this, you know, time where many of us are either at home with their family, a lot of uncertainty. And our hope with this series is just to provide education and an opportunity to virtually connect with the greater type 1 diabetes community within Indiana. So thank you all to joining us for this very first one. Again, it'll be an ongoing series, so I encourage you to continue checking the webpage, the Virtual Connections webpage for upcoming ones. If you have a great idea or a topic you'd like to see discussed, I also want to encourage you to reach out to me. Let me know what you're thinking. And we can certainly find a way to incorporate that in future topics. So I really hope that this will become a growing opportunity for everyone to engage and learn together. So without further ado, I would like to just do a quick review of our agenda today. So obviously I just introduced myself and really just want to give a quick overview of what we'll be discussing. And then I'm going to turn it over to our speaker today, Dr. Jim Malone, who's going to be talking to us. And again, at the end, after we do some reviewing of the different coronavirus resources that JDRF currently provides, we want to open it up to you all. So again, either feel free to add questions into the chat box, or at that time we'll welcome people to unmute themselves as well and ask some of the questions that they might have on their mind. So again, we hope that everyone at the end of this feels like they have a better understanding of type 1 diabetes, coronavirus, and just how to really make sure we're all staying safe and healthy during this time. So I'd like to now introduce our speaker, Jim Malone. He previously worked with Eli Lilly and Company. I really appreciate personally how much he's done for the chapter. He's worked closely with me on some of our committees that we've done. I also think it's fantastic just for him personally. Jim, how much do you think you've probably fundraised through the JDRF ride in all the rides you've done? You know, if you had to ballpark it.
Oh, I guess probably around 20,000.
Yeah. So, I mean, that's fantastic. So even just kind of obviously professionally has a great deal of expertise and knowledge when it comes to type 2 diabetes. But also, you know, his personal commitment to both JDRF and finding, you know, a cure for type 1 diabetes. So I really appreciate that. He will be our incoming board chairperson for the Indiana State Board. So he's currently our president-elect. So we're excited to continue to have his involvement with our board for many years to come. So, but yeah, without further ado, we'll turn it over to Jim to chat a little bit about just how to keep ourselves safe and during this time. So.
Okay, thanks, Sean, for that introduction. And I'm not going to be showing slides at this time. It's just going to be sort of a verbal discussion, kind of my thoughts about type 1 diabetes and the coronavirus that we're all living in. And before I begin, I want to be sure that people realize that I'm going to be talking about general instructions to be healthy with type 1 diabetes in this era of the virus. But for specific medical directions, always contact your healthcare professional who can answer your specific questions. Don't rely on what I say to make any changes to your management. So please contact your HCP. But hopefully, this 20 to 30 minutes will give you a little overview of some of the issues that people with type 1 diabetes face in this era of the coronavirus. So first, just a little bit of background. We all know about the virus itself. It's called the coronavirus because corona is a general class of viruses that primarily cause the common cold. So the common cold that we're all familiar with is caused by a type of coronavirus. But this specific one has the name which you've probably heard called COVID-19. And this was a designation by the World Health Organization, the WHO, who classifies this particular virus by that name. So whether you say coronavirus or COVID-19, it's the same and means the same. And it's hard to believe that only in March 11th of this year did the WHO declare this virus to be a pandemic situation. Although it's been growing since it was first isolated and discovered in China and spreading throughout the world, it kind of reached the threshold of being a pandemic just earlier this month. And as we all know, it's still exploding, especially here in the United States. So it's very appropriate that we talk about this issue today. First, what are the classic symptoms of the COVID-19 infection? Well, primarily, the main three symptoms that most people will experience are number one, a fever, usually a low-grade fever of 100 to 101, maybe 102. A cough is very common because it primarily affects the lungs. And if it progresses, that cough can lead to shortness of breath, sometimes associated with chest pain. And when it reaches the shortness of breath, that becomes a more severe type of infection that you certainly ought to be in contact with your healthcare professional at that point. What are some secondary symptoms? Well, like any other kind of a virus, a cold type virus, you can have generalized aches and pains, muscle pains in your joints even. It oftentimes is associated with nasal congestion, so a runny nose, sore throat, and even diarrhea has been reported. So it's not just the respiratory system; it can also affect sometimes the gastrointestinal symptom. And recently, there's been some interesting reports that some people have noticed a absence of smell and taste, which occurs right before the virus symptoms start. So this is sort of anecdotal evidence, but it's been recently gotten more attention from the medical community that it's sort of a warning sign. If a person is feeling well, but suddenly they notice that they can't smell foods very well, and associated with smell is your sense of taste. So you have a problem with taste, and that may be an early warning symptom that you may be in that early phase of the virus before you develop concrete symptoms. So just something to keep in the back of your mind. So those are the symptoms. What are the chances of getting the coronavirus? Well, we all hear that the coronavirus is rare, but what really is rare? And one way to think about it is in New York City, where we know it's a hot area, the disease is exploding with all the people that live in New York and close proximity. That currently about one in 1,000 residents of New York have been affected with the coronaviruses that we know of. And certainly in other parts of the country, it's a lot less, maybe 1 in 10,000. So it is considered rare, but that doesn't mean that it's not significant. And it's why we recommend to keep the social distance of at least 6 feet from other people when we're out and about to try and reduce the chances of the infection. Now, it's not spread by in the air. So it's not called an airborne infection, but it's called an aerosol infection, which means that the virus particles are attached to saliva. They can transfer from saliva onto hard surfaces. So it's not just in the air; it's more through direct content or contact with the aerosol uh, type material that you can be exposed to an infection. So what do you do if you think you might be exposed? Maybe someone that you live with or someone that you work with has been diagnosed with the coronavirus. Well, the first thing is to contact your HCP to let them know. They will have the most current recommendations from the CDC and others that direct when is it appropriate for a person to be tested. So not every person that is exposed needs to be tested, but we certainly recommend that they isolate themselves in the event that they do become symptomatic. Well, how do you protect yourselves from the infection itself? Well, currently there's no vaccine and there's no approved medication that is used either for prevention or for treatment. All the treatment that the medical community can provide is what we call symptomatic or supportive treatment. We're treating the symptoms and we're supporting vital functions, but we don't have anything currently approved that can directly attack the virus. Now, the good news is there's several clinical trials underway right now to look for an agent that will be effective in treatment. But currently, there's a lot of anecdotal information out there about different drugs that people say have reduced their symptoms or shortened their symptoms. But those are not approved, and I would caution against using anything like that without first contacting your HCP because they would have the most current information about what should and should not be used in that situation. So avoid rumors and speculation that you may hear on the internet or through social media because there's a fair amount of inaccurate information out there. And use trusted resources like the JDRF website that Sean is going to show us later, or the Centers for Disease Control, the CDC, has a very good website. Johns Hopkins University has a website that has the most up-to-date numbers on worldwide infections and deaths. So those are trusted sources of information. Another way to protect yourselves that we've all heard about is washing hands. Washing hands with soap and water for at least 20 seconds frequently during the day helps reduce the potential spread both to yourself and to surfaces that you may come in contact with. And although it's difficult, avoid touching your face because a lot of the transmission comes from hand to face. And so that's something we all want to strive to reduce that facial contact. And obviously, if you're living or working with someone who is sick, whether or not they have the virus, you need to take uh, um, appropriate measures to reduce your contact with that person. Um, so stay at home is the best advice right now. And currently, many states, including Indiana, is now under a stay-at-home directive by the governor. So we're asked to do that. And while you're at home, disinfect commonly used surfaces to keep things clean. What about the use of masks? Does a mask really protect you against the virus? Well, wearing a mask does not protect you. The only person that should be wearing a mask is someone who is ill and maybe has to go out into the community to go on an urgent travel, or a healthcare professional when they're interacting with patients. They have to wear a mask to protect themselves. But for the general public, a mask will not protect you unless you are ill and you're wearing a mask to protect others. So those are some of the general things that we've heard about quite a bit over the last 4 weeks, and just wanted to review those quickly. Well, what about type 1 diabetes? Well, I think the most important fact here to realize is that when type 1 diabetes is well managed and the blood sugars are in the target range, that there's no increased risk of infection or the severity of infection in people with type 1 diabetes who are well managed. And I think a lot of the publicity we're hearing about high risk groups always includes diabetes. And the caveat is those are typically older people with diabetes, typically type 2 diabetes, and specifically those that are not well managed, not well controlled. Those people certainly are at higher risk. But if you have type 1 diabetes that's well managed, your risk is no higher than someone without diabetes. Now we know that high blood sugars will make a person more prone to infection, including the coronavirus. So if your blood sugars are not well controlled, then you are at a potential increased risk. Other secondary conditions that people with diabetes sometimes have are heart disease, lung disease, or other immunity type diseases. And those are other risk factors that if you have those in addition to type 1 diabetes, then that puts you at an increased risk. But the main message is type 1 diabetes is well controlled, does not increase your risk. So how do you manage an illness if you have type 1 diabetes and you become ill, whether it's a virus or not? What should you do to treat yourself at home? Well, the most important thing that I always relied on in my clinical practice years, and I think is important for anyone with type 1 diabetes, is to know specific sick day rules for how to manage your diabetes if you're ill. And this includes any type of illness, be it a respiratory illness or a GI illness or any other type of illness that can occur, is people with type 1 diabetes should have specific sick day guidelines, which they can get from their nurse educator or from their HCP, their healthcare professional, that's specific for that person. It's important to realize that any illness, and especially a viral illness, can cause blood sugars to go high or can cause blood sugars to go low. In my experience, about 80% of the time a person is ill, the blood sugars go up, and about 20% of the time they actually go down because people lose their appetite, they're not eating, they're not drinking, and sometimes the blood sugar can go low. So it's very important to keep hydrated as one of the first steps if you're ill. And the type of hydration depends on what your blood sugars are doing. If you have a high blood sugar with the illness, then you want to use liquids that have a low or no sugar content. If your blood sugars are running on the low side, then you're going to want to use liquids that have some carbohydrate or sugar with them. So it's very important to keep well hydrated when you're ill because dehydration can make the illness a lot worse. The next thing to do is to test your blood glucose and your ketones at least every 4 hours while you're ill. And if you're wearing a CGM, then then you have access to continuous blood glucoses, which is a big help. But you still ought to have a meter with you because sometimes the CGM may not be as effective during an illness because of the wide swings in blood sugar that can sometimes be seen. And so you always want to verify the CGM readings occasionally with the blood glucose. And very important to check your ketones along with the blood glucose, also about every 4 hours while you're ill. Why do we check for ketones? We check for ketones because that's an early sign of the body beginning to burn fat and producing acids and ketones in the body, which can build up and lead to that dangerous condition called diabetic ketoacidosis, or DKA. So we always want to, as part of our sick day guidelines, be on the lookout for moderate or large ketones, which may be a warning that you're entering into that condition called ketosis, which occurs just before someone will develop DKA. And so certainly if you start seeing moderate or large ketones, contact your HCP at that point to make sure you're following specific instructions. What are some of the symptoms of DKA if it should ensue? Well, typically a person becomes very ill, more ill than the illness that started it. They have nausea and vomiting, intense abdominal pain. They have rapid breathing, and sometimes that breathing has a fruity odor to it from the acetone that's being expelled. So at that point, you're in early DKA and you need emergency treatment right away. Don't delay at all. What about other medications that people take during an illness? Well, you have to be careful with even common medications like high dose aspirin, which some people will utilize, can actually sometimes lower blood glucose. Ibuprofen, a common anti-inflammatory agent, can also lower the blood glucose for people who take insulin. And even Tylenol, which is very good for fever and for aches and pains, can sometimes lead to false readings on your CGM device. And also in high doses can cause liver or kidney damage. So you never want to take above the recommended doses of Tylenol. Although it's a great drug, be careful of your CGM readings and don't take doses above what's recommended, because it can have toxic effects on your liver or kidney. And how about food? Well, food is important in addition to hydration because your body still needs food while you're ill. And so you can start with liquid type foods like easily digestible foods like soups, yogurt, solid foods that are easy to digest are like crackers, unsweetened applesauce, things that you can get down easily. Be sure to stock up with food and liquids when you become ill, so that you don't run out in the middle of your illness and may not have access to the hydration and food that you need. How about your diabetes supplies? Well, again, you want to stock up on your insulin, on your blood glucose devices, anything you're using to help manage your diabetes. You want to have an adequate supply to get you through the illness. And so be sure that on your supplies you have plenty of refills. During this time, you can get refills very easily, as long as you have the prescription from your HCP. It brings up a question about are we running low on supplies? And the answer to that is no. The JDRF has surveyed all the major diabetes suppliers, suppliers of insulin and supplier of devices, and currently there are no shortages of the needed diabetes supplies. Well, what about insulin? The good news there is that there's no restriction or no threat to the supply chain of our insulin products. And so just like food and hydration, it's very important to have adequate an insulin supply. One what happens if you're running low, or if you can't afford your insulin because of insurance difficulties. Well, contact the manufacturer first, because they all three manufacturers have programs that can help people get access to the insulin products they need. So, for instance, Eli Lilly and Company here in town has started a Lilly Diabetes Solution Center, which is on their website, with a phone number, and uh, they are specifically designed to help people get access of insulin who are having any difficulties with access from insurance or supply reasons. A good backup piece of advice also is some people, through no fault of their own, may suddenly lose their insulin or don't have adequate supply. And what do you do if you're out and about and you suddenly find you have no insulin? Well, it's good to have a backup plan. And here's a good backup plan for you. Walmart stores carry human, regular, and NPH insulin. These are our older insulins, not the newer analogs. But the real advantage is you can get these products through Walmart without a prescription. These are non-prescription items, and they're sold at a reasonable cost. So that's always a nice backup plan, if ever you find yourselves without necessary insulin, is access to the Walmart human insulin, regular, and NPH. Now, of course, I'd always recommend that you contact your HCP at that time, because going from your analog to your human insulin may necessitate a change in dosage or a change in your insulin schedule. So you want to be aware that it's not the same as analog insulin, but they're similar. And we used human insulin for many years before analogs became available, and it's a really good backup plan. So those are some of the topics I wanted to cover with you today. Again, this is a general overview of type 1 diabetes and the coronavirus. I hope it gives you some perspective and some general guidance on how you can protect yourselves and others during this trying time. So I'll turn it back over to Sean at this point for to look at some of the resources available to patients and their families.
Sure. Thank you, Jim. Really appreciate you kind of talking through some of those topics. So at this point, again, want to invite, in our chat, if you want to throw in some questions that we'll get to at the end, or again, if you're on the phone, in probably about 10 or so minutes, we'll open it up to questions as well. But if you are able to follow along on the WebEx, I'll kind of walk us through some resources, also try and describe them, because I know it looks like some of you might be on the phone as well. And so I'll try and do a good job of kind of catering to both of those. So let me go ahead and move to our website here. Okay. Jim, have you seen the website at this point?
Yes, I can see it.
Perfect. So this is our landing site right now for coronavirus updates and general information. It's jdrf.org/coronavirus. So, right here at the top, a big notice letting you know that, again, to our awareness, and let me just tell you, from my perspective as a JDRF staff member, we are hearing from our CEO, everyone we're talking to, that JDRF is very closely communicating with the T1D medical supply chain. So we are very much in talks with them, making sure that we are aware of any potential issues down the line. So we're kind of keeping our ears to the ground. At this point, there is no impact to the medical supply chain, as Jim alluded to before, which is good. They are prioritizing and in many cases took decisive action ahead of time to ensure that they would be able to keep the supply going. So as we scroll through the website, it gives some just kind of general updates about COVID-19. So at the top, it gives a lot of information about the coronavirus disease. So I'm not going to reiterate a lot because Jim did a great job of kind of covering some of the symptoms, how someone will know, how they will protect themselves, those types of things. But it's just a great resources just to make sure that you are educated and know the particulars about the COVID-19. And then the second section is what should someone with T1D know about having a viral illness? So again, Jim did a great job of giving us an overview, letting us know when properly managed, type 1 diabetes, you're not at an increased risk again. And frankly, this video that's in this section is, I think, a great video to check out as kind of a extended view to type 1 diabetes and COVID-19. But as with anything, as with any disease, I think there's the risk with if you do develop either COVID-19 or flu or any other disease or illness. That's when you really want to make sure you're monitoring your blood glucose and ketones. So this part of the website really walks you through with either a loved one or yourself with type 1 diabetes, what you should be watching out for. Again, continuing a normal schedule of medications, stock your cabinets with whether it's food, water, soups, those types of things, stock of supplies. There's a number of links here which are great under stock of supplies that take you to different websites, Medtronic, Dexcom, Lilly, Insulet, Omnipod, Mankind, who produces Afrezza, NovoNordisk, Sanofi, Tandem, and Xeris are listed as websites that both have specific resources on COVID-19. They have put out public statements and given updates on their personal supply chains. So if you haven't already, and if it's a cause for concern or something you want to learn more about, visit the website of some of the companies that you use. If you're on a Dexcom, check out the Dexcom website and read what they are currently saying about their supply chain and their approach to COVID-19. I think the one positive thing that I've kind of seen is so much, I think, beneficial communication and thoughtful communication. I think one of the worst things that could have happened would be, everyone's kind of silent or not sharing what they're doing. So I definitely think a lot of these companies are making sure that the people who depend on their products are aware of what is going on and what the supply looks like. So definitely check some of these out. So I'll just touch on, and again, Jim mentioned some of the resources that some websites are putting out. So specifically, for example, Lilly, this is what their website looks like right now about their global COVID-19 response. It has, if you're local here in Indianapolis, obviously Lilly's here. It has some information for Lilly employees or Indianapolis healthcare workers. It has kind of a number of different resources all in one handy place. So I think this is a fantastic example of a website that Lilly has put together to again, promote awareness and information to the general public. We have just yesterday, right, an announcement from them, March 23rd, and so on. So almost daily, you're seeing those types of updates, and a lot of those websites are having those daily updates. So I think it's, definitely go to these in an attempt to, educate yourself. Hopefully that it's a cause, or it's a source of, um, you know, feeling better, and knowing that they are taking it seriously, and making sure that they are keeping the supply open for all the different products. Jim also mentioned some of the affordability um, resources that are out there. So one specifically for Lilly is their Diabetes Solution Center. They have made a commitment to, if you are struggling financially, or just need to kind of talk with someone about your medication needs, to give them a call and to visit their Diabetes Solution Center. Jim, was this, I think it was in the last year they rolled this out, but it's just a great resource to have um, going forward. They also have, some discount programs, things of that nature. Jim, I see you unmuted. Was this in the last year that Lilly rolled this out?
Yeah, so it's a new center that they just established within the last 6 months.
Yeah. Yep. So, a good resource. And even if it's not yourself, I think it's great to know that this is here for other people in the community that you chat with. I know there are countless parents groups, adults with T1D groups, Facebook groups, chat groups, etc. So, if you see someone, mentioning that they are struggling or worried, just know that hopefully that these resources are there, and that you can help direct them to that. And obviously, part of my role on the staff is to help find resources as well. So feel free, if I can be of help in any way, to loop me in as well. Um, and then, here's another resource from NovoNordisk that they put out. It was kind of a commitment to a 99, I believe it's $99 a month cost for the insulin needs that you have. So, there's some terms and conditions and things of that nature, but Novo Nordisk put out this kind of similar type thing recently to basically make a commitment that, regardless of socioeconomic conditions, or what might be going on, that you have an avenue to access the insulin that you need, especially at a time like this. So that's just another example of a resource that is provided. Something that I didn't know until recently. Jim also mentioned the Walmart, affordable insulin. So that's something that actually wasn't possible within the state of Indiana until recently. And so I just like to plug, some of the advocacy efforts that, within our state, and that JDRF does, I think enables us to make those types of things possible. So if you aren't yet, I recommend that you join our advocacy program. If you go to jdrf.org/advocacy, you can sign up to be an advocate. You can get text alerts and emails if there's, an important legislative piece that, we're asking our advocates to contact their legislators about. Or sometimes, not particularly now with the current coronavirus pandemic, but oftentimes we have opportunities to interact and meet with different legislators within the state. Those are incredibly important. It enables, you know, our legislators to meet one-on-one with the T1D community. And if you ever have a chance to participate in those, it's a fantastic way to really make sure that they know personally, how type 1 diabetes affects people and why it's important that they, continue supporting the Special Diabetes Program, which funds diabetes research and a number of other diabetes type program. Jim, did you want to weigh in? I'm not sure if you were about to say something.
Well, I just wanted to add one other thought that came to my mind. Is another option that people now have in interacting with their healthcare professional is using a system called Telehealth.
Oh yeah.
So telehealth is where you can video chat with your HCP. And recently, they've lifted the restrictions on telehealth, where it used to be only for rural audiences, and it required special software for the patient to communicate with their HCP. They're now lifting those restrictions as people are under travel restrictions now. That there's now the opportunity to have even routine visits with your healthcare professional through telehealth. So I'd recommend that you contact your healthcare professional and see if they are offering a telehealth alternative, because that might be a really good way during these trying times to keep in close contact with your healthcare professional.
Yeah, I think that's a fantastic addition, knowing that that's something that's really been rolled out in a more broad fashion. It kind of was a thing, but I mean, I never used it, and I know that's definitely something that is more broadly available. Um, so yeah, and then finally, so I kind of went through some of those specific, not every single one of the websites talking, but a couple. There's also on the jdrf.org/coronavirus information on state level emergency orders, and then just some additional resources. So, the website for the CDC, the World Health Organization, travel concerns, and just again, full circle back to kind of the affordability. If you have never visited, I definitely recommend going to the JDRF Health Insurance Guide. It talks about everything from, insulin affordability, but also just in general how to navigate health plans. So it's a great resource out there as well. Um, so before I kind of open it up to some general questions, I just want to give a quick update as well on kind of JDRF here on a local level at the Indiana State Chapter. So like many, we are, a staff that is currently working from home. And through June 30th, JDRF has made the decision to cancel all of their in-person events. So this affects our spring walks, our spring one walks, which is our large community fundraising events that brings together, hundreds and thousands of people depending on the walk. And so for the spring, we have planned one in Terre Haute, one at Holiday World in Southern Indiana, and one in Mishawaka. So we are currently in the stage of reinventing what that looks like as a virtual walk. So I want to invite everyone to consider supporting our One Walk program. Those funds help go to research, help go to finding a cure for type 1 diabetes. The research needs haven't ended. Our fundraising hasn't ended. So I encourage you to check out our One Walk program. The Indianapolis One Walk is our other walk, and that's scheduled for September 20th. So at this time, that's still going forward as scheduled. So if you're in the Indianapolis area, I recommend start a team. Think about how you'd like to fundraise for a cure, how you'd like to recruit people to join your team, those types of things. Similarly, in the spring, we have our JDRF gala typically, which again we will be reimagining as a virtual event. So this gives in many ways an opportunity for a lot more people to take part in, whether it's our silent auction or a number of different ways of engaging and fundraising for a cure. So I encourage you to keep an eye out for what our gala will look like moving forward. And then finally, we put on a number of in-person community events throughout the year. That's one of my main roles on staff. Well, that's on hold for now, and so we're going to continue holding these virtual connections events. So tomorrow is our next one. We'll be joined by Matt Creek, who's a runner, a cyclist. He's with type 1 diabetes himself, and he's going to be talking a bit about how to stay fit, healthy, making sure that we're kind of exercising with type 1 diabetes well. So that's going to be taking place tomorrow from 4 to 5 p.m. Again, it will be recorded, but that'll be our next virtual connections program. And we'll be having a number of them moving forward. So if you have a topic you'd like to see, or, I definitely encourage you to reach out and let me know what you'd like to hear about. I'm currently reaching out to some of our local Indiana researchers to see, if they'd be willing to present about some of the cool research that they're doing in type 1 diabetes, and we'll move forward based on that. So that was just kind of a quick, maybe general JDRF update that I wanted to provide. All of us are still working. All of us are still here for, your needs and your ways to engage with the community, or again, our principal mission of fundraising for a cure for type 1. So at this point, I would like to invite people to either, unmute themselves if they would like to ask a question to Jim and myself, or, if you have the WebEx and would prefer just to drop a question in the chat function as well. I'll keep an eye on that, but want to open it up to questions during this last 10 minutes that we have here together. So Jim, we have our first question. So from Leah, she asked about ibuprofen, if it makes COVID-19 symptoms worse. So I'll kind of toss this to you if you've heard anything kind of related to ibuprofen.
Yeah, there has been a fair amount of what I call anecdotal information about ibuprofen. And I mentioned earlier in my talk that ibuprofen can sometimes lower blood sugars for people on insulin. So that's one effect that it has on anyone. Not a dramatic lowering, but somewhat lowering. Now, the main side effect of ibuprofen is stomach and intestinal side effects. So it can cause stomach cramping, GI distress, especially if it's taken on an empty stomach. So for anyone that takes ibuprofen, I always recommend that they take it after a meal, because that helps reduce those GI effects. Now, I think what effect does it have on coronavirus itself? That is really has not been well characterized, and I would say that goes into the information of unsubstantiated thoughts. Some people think that ibuprofen may help. Some people think it may worsen. A lot of people use ibuprofen to treat fever and aches and pains. And so what I would recommend is if you find that that you use ibuprofen for other conditions, that there's no reason that you cannot use it during an infection with the COVID-19. Just be aware of the potential side effects of the stomach and the blood sugar, but it does not specifically worsen the effects of COVID-19 that we know of.
Perfect. Thank you. Right, again, invite if you want to. Let me make sure. Um, if you want to unmute yourself or I want to make sure. All right, I just unmuted everyone on the call, so hopefully that doesn't scare anyone. Just in case anyone's not able to unmute themselves. So again, want to invite if anyone's on the call and has any question for Jim at this time. Perfect. Well, Jim, any kind of final words or anything else that you'd like to share? Otherwise, we'll kind of wrap up this initial virtual connections program.
Well, I guess my last thought is that I'm so glad that you recorded this, Sean, so that people who weren't able to join us today, or maybe since it's a new program, weren't aware of it, can access this at any time remotely through the Indiana State website. So for those that were able to listen in, please let others that you know of know about this particular program and direct them to the Indiana State JDRF website so they can hear this after the fact and hopefully benefit from some of the information we shared.
Excellent. Perfect. Well, thank you all so much for your time today. I so appreciate you joining us for our very first Virtual Connections program. Again, our next one will be tomorrow at 4 o'clock with Matt Creek, who will be speaking on kind of exercise and staying fit with type 1 diabetes, particularly these days when many of us are either at the home or doing less general movement, as I found. My step counter on my watch has dropped dramatically since this kind of work from home has started. But thank you all for joining us and hope you have a great rest of your day. Thank you.